my name is Suraj Varia and I'm a Regional Facilitator on the Pre-Reg and General Practice Programme at Health Education England, and I cover London, Kent, Surrey and Sussex. I'm also a community pharmacist for part of the week and a GP practice pharmacist as well.
Hi, my name is Zenia Bray. I'm one of the regional facilitators in the South for the Pre-Registration Pharmacists in General Practice Programme. I work part-time and job share with Rosie James and Caroline Murphy. I wish you all the best for your coming pre-reg.
Hi, I'm Brenda Sandhu. I live in Leeds and I'm the Yorkshire and Humber Regional Facilitator for Pre-Registration Pharmacists in General Practice project. I will be seeing you at the online induction event for pre-registration tutors and trainees in August. I look forward to meeting you all one day. I wish you the very best for the year ahead. Bye for now.
Hello, my name is Rosie James. I'm a regional facilitator in the South on the Pre-Registration Pharmacist in General Practice programme, along with my colleagues Zenia and Caroline. I'd like to welcome you to your pre-registration year. I hope you have a fabulous and a diverse experience. We're all here to help you get the best out of it. Good luck.
Hello, my name is Busola Daramola. I'm one of the regional facilitators for integrating pre-registration pharmacists into general practice. I cover the East of England area, which consists of 6 counties: Essex, Bedfordshire, Cambridgeshire, Hertfordshire, Norfolk and Suffolk. Wishing you the very best in your pre-registration year.
Hi, my name is Caroline Murphy and I'm one of the regional facilitators for the GP Pharmacy Pre-Registration Split Programme for Health Education England South, along with Zenia and Rosie. Together we cover South West and Thames Valley Wessex. I'm really looking forward to meeting you all in person, and I hope you have a fantastic time in your training year in both your host pharmacy and in general practice.
Hi, my name is Mayada. I'm the Regional Facilitator for the North West. I hope you enjoyed today's session and I look forward to working with you all over the next 12 months.
So why are we offering split placements? The NHS long-term plan commits to increasing the number of pharmacy professionals working primary care over the coming years. The plan sets out how patients and the public will increasingly rely on clinical care provided by the pharmacy professionals across all healthcare sectors. The challenge now is to ensure sustainability and consistency across the country, whilst ensuring workforce supply and development, so that we have pharmacy professionals where they are needed with the right skills and support. This will require new models of initial education and training for pharmacists, including cross-sector pre-reg training pathways to develop a pipeline of pharmacists who have the skills and knowledge to work across sectors. This programme aims to expose pre-reg pharmacists to general practice for a significant proportion of their training year, at least 13 weeks, preparing them for registration with the knowledge and skills defined in the performance standards, and able to deliver pharmaceutical services across sectors in the NHS. There are a range of potential models for structuring your GP placement. They may be carried out as a block or split weeks. The model you choose will be dependent on a number of factors, including the working pattern of educational supervisors, the number of trainees that you have at your training site, and the distance required to travel between the GP practice and the pharmacy. Whichever model you choose, you must ensure that the pre-reg is based with their educational supervisor for the appropriate number of hours as set out by the GPHC, 28 hours over 4 days per week. Trainees must be supported to meet the placement objectives and outcomes and have facilitated multidisciplinary learning in general practice. Most pre-regs will have a separate educational supervisor based at both the employing pharmacy and the general practice. The educational supervisors have a number of roles, including supporting the pre-reg to get the best from the training year, supervising their practice, and providing regular feedback and completing the GPHC formal reviews and final sign-off. In addition to meeting the requirements of the regulator, the placement will support the pre-reg to understand the role of the clinical pharmacist in general practice. It is a great opportunity to develop communication and consultation skills and begin to undertake basic assessment skills. The placement objectives include monitoring ongoing treatment and making recommendations for common chronic conditions, whilst understanding the need for a holistic approach and the importance of shared decision making. We recognise and acknowledge that the current situation with COVID is likely to have some impact on patient face-to-face work.
COVID-19 has impacted on the way that we work in all sectors of practice. However, some of the greatest changes have been seen in the way primary care services are delivered. Many placement providers and trainees who were participating as part of the programme during the first year had to make adjustments to the planned delivery of the pre-registration placement in general practice. A webinar was hosted jointly between Health Education England and the Primary Care Pharmacists Association in June to learn from the experiences of those involved in the programme and to support planning for this coming year. We strongly urge all trainees and tutors participating in the programme to watch the video, and the link is here on this slide. In light of this, we want everyone to be aware that adjustments may need to be made to placements based on a second and a possible third wave. Also, placements may differ from initial expectations and plans. General practice is slowly increasing the number of face-to-face consultations, and we encourage a face-to-face experience where permissible for the pre-registration pharmacist. However, the majority of consultations are still remote, and this means that the placements may differ from initial expectations and plans. We recommend GP practices to make use of the technology to support learning and remote working if needed. We have also developed a question and answer document which will be provided to everyone. Please do not hesitate to contact your regional facilitator if you require any advice or support.
So what are the expected outcomes of your placement in general practice? For those who are on the 13-week placement, we expect you to have a good understanding of general practice and how general practice runs, and particularly what the role of the pharmacist is within the team. We expect you to undertake a minimum of 2 assessed basic patient medication reviews and receive feedback on those, and I'll get to that again in a minute. We expect you to be able to carry out some basic clinical assessment, to be trained and assessed as competent to do them. These include measurement of weight, height, BMI, heart rate, respiratory rate, temperature, blood pressure, oxygen saturations, to be able to carry out urinalysis tests, measure capillary blood glucose, and peak flow. The impact of COVID obviously is affecting the way we work. However, many practices are still carrying out remote consultations. And this still provides abundance opportunity for learning and development for both the trainees and their tutors. Because of the COVID, the experience may differ from our initial expectations and plans, and it may be difficult actually to achieve all the expected placement outcomes, especially those relating to patient-facing clinical skills. However, as said earlier, many practices are adopting a lot of IT means to support the learning of their trainees, and they're also using simulation and interprofessional learning with other trainees. For example, if there is no patient to use on a face-to-face basis to teach a trainee how to measure blood pressure, for example, they could use other trainees or other staff within the practice to teach the trainee and also to assess the trainees. So practices are using innovative ways to ensure that trainees are still getting the learning and the training that they require. Now, for those on the 26-week placement, we expect you to have an in-depth understanding of general practice, how it's run, in addition to how it links with other care providers within primary care. So you may have a rapid response team in your area, the community nurses, the district nurses, the mental health, community mental health team. So if you're spending 26 weeks, we expect you to understand how general practice links in with all these other service providers within the community and within primary care. We expect you to undertake a minimum of 4 assessed patient medication reviews, and we expect you also to undertake the basic clinical assessment skills, to be competent at doing them, and we expect you to have completed a quality improvement project or an audit cycle. Now, in terms of the basic medication review, examples include post-discharge review, perhaps following an MI, or an asthma review, hypertension review, or a medication switch that requires a face-to-face consultation. For basic reviews, really, you should focus on one condition for your basic review. It could also be a discharge reconciliation or appropriate monitoring, target BP, cholesterol, or a requesting for use and ease, or it could be around patient counseling. Now, for the complex reviews, we expect that the focus will be more than one condition, so multiple medications for multiple conditions. So basically the review of patients with comorbidities, multiple polypharmacy and adherence issues, those are more complex reviews. And we are here as the team, we're here if the issue of face-to-face consultation is proving difficult and you need advice on how some of these outcomes can be achieved. Please feel free to call us, send us an email, and we'll be able to discuss with you on a one-to-one basis your personal and particular circumstance. Thank you.
I'm going to talk about the framework for pre-registration pharmacists working in general practice. This can be found in your handbook starting on page 11, and then there is a more detailed framework to be found in Appendix 2 on page 37 of your handbook. Don't be overwhelmed by the framework. The attributes stated are for a qualified foundation pharmacist. We aren't expecting you to demonstrate these straight away in your pre-registration year, but work towards them. It's an opportunity for you to work both towards the GPHC performance standards and develop the attributes defined in the foundation framework ready for day 1 of your registration. You'll also find that it's a recurring set of core activities that are listed in the detailed framework. The aims of the framework are to articulate the areas in which trainees can develop during their general practice placement. There's a list of activities, as I mentioned, that can help trainees to develop their capabilities and attributes of a GP clinical pharmacist. One of the attributes, for example, is applying clinical knowledge and skills. And then a capability within that attribute is demonstrating a proficient approach to basic clinical assessments. We then provide descriptors in the detailed framework that can help in assessing individual capabilities or attributes. So every capability has a descriptor. So for the capability demonstrating a proficient approach to clinical assessments, we have a descriptor of demonstrates the ability to make a clinical assessment. And then there's a list of activities that support each descriptor. So for that one, for example, there is undertake with appropriate supervision the listed physical assessments. The framework is there to assist in identifying and prioritising your learning needs. It's been developed to support trainees, educational supervisors and practice staff, but it is a support tool, so there's no extra supporting evidence required on top of your evidence for your GPHC performance standards. The capabilities and the descriptors have been developed from the CPP curriculum for pharmacists in general practice, and the idea is for the attributes and capabilities to be developed together in tandem. The suggested activities are then mapped to the performance standards to help you write up your evidence. The activities listed are very much dependent on your confidence, your competence, the complexity of the activity, and also when your placement takes place during your pre-registration year and how long the placement is as well.
I will now be talking about the section on assessments and tools. The pre-registration training year offers the opportunity to apply academic knowledge in a real-life situation. The aim is to develop and demonstrate the skills, knowledge and behaviours needed to practice to the standards expected of a pharmacist, and in a way that delivers the best outcome for patients and members of the public. To successfully complete the pre-registration year and become a pharmacist, trainees must be able to demonstrate that they have the knowledge by passing the registration assessment and experience developed during the pre-registration year needed to practice as a pharmacist. This is assessed by being formally signed off at least 4 times by the educational supervisor as part of the GPHC mandated 13-week progress reviews and passing the registration assessment. Throughout the pre-registration year, trainees will be supervised and should be provided with regular feedback by those who are providing the supervision. As trainees develop their reflective portfolio of evidence that allows them to demonstrate competence against the 76 performance standards, they should be provided with opportunities to undertake a range of activities and receive feedback. As part of this process, a number of formative assessment tools may be employed. There are templates for a number of potential assessments outlined in Table 3 of the GP Programme Handbook on pages 13 to page 15. These can be utilised to support the trainee's development while working in general practice. With the exception of the medication review and consultation assessment, there is no expectation of when and how the assessment tools are used. This can be decided between the supervisors and trainees, and other tools or methods of formative assessment may be used in preference. Next is the medication review and consultation assessment. The assessment tool is designed to test the range of knowledge, skills and behaviours trainees are expected to develop in their general practice placement. It should be used as a formative assessment tool to help trainees identify areas for development and demonstrate progress. The supervising clinician should assess the trainee based on the expectations of a newly qualified pharmacist. After using the assessment tool, trainees are expected to complete a reflective record of evidence and develop SMART objectives for further development. All trainees are expected to undertake a number of MRCAs as part of their training period in general practice. Moving on to the KEPSR handbook, the clinical assessment skills. Now, we are obviously in COVID-19 pandemic, so there will be some thought required as to how this can be achieved. As described in the placement outcomes, all trainees are expected to have exposure to and develop some level of competence in clinical assessment skills during their placement in general practice. Focus should be on those clinical assessment skills that are most relevant to the pharmacist's role in their practice. You may want to consider practicing on other healthcare professionals, on family, or with other pre-regis. Now, the next formative assessment is the mini clinical evaluation exercise, the mini KEX. Now, discussion of clinical reasoning decisions in real life situations. It may be that you respond to a medication query, you're conducting a medicines reconciliation, or a medication review. The intervention recording, IR, could be where a clinical intervention is being considered by the trainee. It could be an intervention picked up as a result of a medicines reconciliation in response to a medication query from a patient or another healthcare professional, or during a medication review. The next formative assessment we're talking about is the case-based discussion. This is where you would want to explore a more complex patient medication regime and to look at in greater depth in order to deepen your understanding of the disease or the medicine. It could be a complex medicines reconciliation process. And basically you would want to do this either in a peer group review or with your clinical supervisor or another healthcare professional. Thank you.
We're going to take a look at a session now around support. So at the live induction events, we will discuss support available during the year and look at all the different people that are there to support the trainee during the year. But for the moment, we just want to draw your attention to the area of the handbook around trainees requiring additional support. So for the majority of trainees, the year will go smoothly and they will progress as we expect and achieve all their competencies and sit the exam at the end to become a pharmacist. For some trainees, life happens and unexpected bumps in the road occur and they may require extra support along the way. It may take the form of lots of different areas and it may be highlighted to you or the trainee in various ways. So it's worth just thinking about the areas where a trainee may need more support and how you might identify that. So the trainee may highlight themselves that they are struggling and that they need some extra support and come to you directly as education supervisors, and then we would expect some sort of action plan to be put into place. There may be other indicators that you'd have to look for as education supervisors to realise that the trainee is struggling. So it might be something like significant or frequent absences, lateness coming into work. There may be issues flagged at progress reviews or interim meetings that the issue of support comes up. It might be during formative assessments that we realise a trainee is perhaps not progressing as well as we would like them to, or that there is a knowledge or skill gap. There could be a significant incident that happens either in the GP practice or when they're in their base training environment that would suggest that there is an issue that needs extra support. It could also come as feedback from colleagues or peers. So we know the pre-reg year can be difficult to adapt into for some trainees. They're leaving university, going in away from that support network at universities and might be more isolated being a pre-reg. Might be the first time that they've been living in that particular location. Might be the first time they've done extended full-time work, and that can be something that they find difficult. So one of the things we've produced to try and help you as trainees and education supervisors to identify what the issue is and what to do about it, we've developed a RAG matrix, a red, amber, green matrix. This is available in Appendix 4 of the handbook for you to look at. And it just details the different areas where a trainee may struggle. So it's broken down into sections on the left-hand side, including a knowledge or skill, progression in training, patient safety, communication, partnership and teamwork, professionalism, health and well-being. So, the issue that the trainee is having could fall under any one of those headings. And then across the top you've got, so green would be no concerns. Obviously that wouldn't need documenting as needing extra support. Into the amber category, it's broken down into concerns of the educational supervisor, concerns of the trainee, what action planning or support you would want to put in place on the basis of that. So anything that falls into the amber category might be the first time that that issue is arising, that you have had a meeting about it, you've put an action plan in place and agreed support within the training environment. So whether that's the GP placement or back at the main training environment. If an issue becomes high amber or red, at this point I would suggest that in terms of action planning and support, that the regional facilitator for your area is informed about the issue and the action plan that's been put in place. It's far easier for us to support you early than things go a long way down the road, and it's harder to get things back on track. So anything coming up as a high amber or red, so whether that is a significant concern raised or there's been some sort of significant incident within the training environment, we would want to know about that as regional facilitators. Across all of the red, amber, green matrix, we would suggest that you document the meetings and what the outcomes have been. If things aren't written down, they didn't happen, and documenting it will mean each party is clear on the action. It will mean that the trainee is very clear on what they need to do to progress, and documenting the meetings and the action plans will also give a timeline of events to support any future decisions about what that trainee needs to do. Specifically, if we're looking at unsatisfactory reviews and potentially needing to sit a later exam and not being signed off at the 39-week point, documentation of meetings that have been had and action plans that have put in place are absolutely crucial. It's worth noting here that any action plans regarding the trainee's performance need to be shared between both education supervisors and the trainee, and preferably they should be dated and signed. Hopefully, of course, this won't happen, and as I've said before, the earlier issues are identified and support put in place, the less likely it is that we get to a point that the pre-reg will have to defer registering as a pharmacist. If you have any questions around this section, please do look at the handbook for further details, and Appendix 4 for the full matrix, and there will be an opportunity at the main induction events to ask questions about support. Thank you.
As healthcare professionals, we have a duty to raise any concerns that might impact on patient care or on our colleagues. For example, if you see poor clinical practice or if there are unsafe working conditions. Each organisation should have its own procedure for raising concerns, but if you feel you cannot talk to someone within your own organisation, you can always speak to your regional facilitator or any of the other pre-reg leads. If you're not sure whether your concern is genuine, you can also contact Speak Up, who can provide free, independent and confidential advice on the speaking up process.